Hello everyone, welcome to Community Medicine Insight. In this video, we will talk about World AIDS Day 2025 and theme of this year is Overcoming Disruption, Transforming the AIDS Response. Let's understand what this means globally and for India. So why World AIDS Day matters? The theme of this day is to educate people about HIV prevention, promotion of testing and treatment, and fight the stigma and the discrimination which is associated with the disease. Each year, World AIDS Day has a special theme that we focus on a key issue related to HIV and encouraging people and communities worldwide to come together and strengthen their efforts towards ending HIV/AIDS as a public health threat by 2030. The theme of the current year is Overcoming Disruption, Transforming the AIDS Response. HIV services are disrupted by the conflicts, pandemics, migration, and the economic instability. These disruptions increase new infections and treatment interruption. So, the focus of 2025 is the resilient, rights based, integrated HIV program, and the emphasis is on the innovation, community led services, and equity for vulnerable groups. We'll see in little bit detail about the disruptions which are affecting the HIV response. First is crisis and conflicts. What happens in situations like wars, natural disaster, political instability, or the pandemic? There is an interruption in the routine services. And this leads to the HIV testing centers shutting down, or the ART refills being delayed, or there is an interruption in the availability of pre-exposure and post-exposure prophylaxis, and the healthcare workers, they are also being diverted to the other emergencies. So when the continuity of care breaks, the people may develop high viral loads and thus it increases the risk of transmission. Second is funding gaps. So global HIV funding has plateaued and decreased, especially in the low resource setting. So this causes reduced prevention program like reduced condom distribution, fewer outreach activity among the high risk groups, and fewer community led services. So without adequate funds, the HIV control efforts, they are weakened significantly. Third is stigma and legal barriers. So HIV is still associated with the social stigma, discrimination, and the judgment. So people, because of fear, they avoid HIV testing, and many may seek help only when they become very sick. And the women, adolescent, and some communities, they often hide their symptom. So the key population avoid the government services due to the fear of harassment, and that leads to delay in diagnosis. Fourth is inequity. There are certain groups which carry a much higher risk of HIV, but they have a less access to services. These groups include men having sex with men, people who inject drugs, sex workers, migrants, refugees, and transgender persons. So they often face stigma, harassment, legal barriers, and the poor availability of friendly services. So this inequity, they help in the sustainability of HIV transmission cycles. Fifth is rising drug resistance. HIV drug resistance is increasing due to the irregular ART adherence, interrupted treatment, which may be due to the crisis or stockouts, and the inconsistent supply of first-line drugs. So when the resistance develops, the current ART becomes ineffective. The patient requires expensive second or third line regimen. When the viral load rises, there is a high transmission of risk. So drug resistance HIV threatens the global progress. In many countries, the services for HIV, tuberculosis, and the sexually transmitted infection is not integrated. So, when there is a fragmentation of services, that may lead to the missed opportunity in the diagnosis, and the patient may need multiple visits, and there will be poor follow up for co-infections. All this will lead to the increased morbidity and mortality. So the integrated services are essential for a stronger response. To overcome these challenges, the key global messages are to have a strong political leadership that will protect HIV budgets despite the global crisis. International global cooperation to close the funding gaps, a human right approach a human rights approach to eliminate the stigma and the discrimination, and empowering communities to lead testing, treatment, and the outreach efforts. Let's look at the global HIV situation. There are around 40.8 million people living with the HIV worldwide. In 2024, we saw 1.3 million new infections, and 77% of the people living with HIV are on treatment, but still the treatment gaps persist. Children accounts for 4% of infection but 13% of deaths, and adolescent girls, young women in many regions, they remain disproportionately affected. So HIV is still a major public health challenge, especially in a low resource settings. The global goal is that by 2025, the 95% of the people with HIV should know their status, and 95% of those diagnosed should be on ART, and 95% of those on ART should achieve a viral suppression. By 2024, we have achieved these targets by this percentage respectively. Coming to the situation of HIV in India, according to the recent India HIV estimation, over 2.5 million people are living with HIV in India, and the adult HIV prevalence is 0.2%. The new annual HIV infections have decreased by 44% since 2010, which outperforming the global reduction rate of 39%. What are the public health implications of this data? India's low national prevalence of 0.2% shows that the success of sustained prevention and the treatment programs. There is a decline in the new infections that reflects the effective national strategies under NACP. There is a high ART coverage, and yet the epidemics remains heterogeneous, needing the state-specific and population-specific strategies. There is a need of continuous strengthening of HIV testing, pre-exposure, post-exposure prophylaxis, prevention of mother-to-child transmission, and community-led services to achieve the 2030 goal. What are the ongoing challenges in India? Certain regions like Northeast and the many high-risk pockets, they continue to have a high burden. The key population, such as who inject drugs, sex workers, men having sex with men, migrants, they still face a stigma and the limited access to the services. Late diagnosis is common, which increases the mortality and ultimately leads to the poor outcome. Stigma and discrimination at workplace, families, healthcare affects the testing and the adherence to the treatment. Emerging resistance threatens the first line ART effectiveness. Sustained funding is required for the prevention programs, and there is a limited mental health support.